Most paintings invite you to look. This one dares you not to, because the longer you stare, the worse it gets. At first, it just looks dark, crowded, maybe even a little confusing, but then your eyes adjust. And suddenly, you see it. The blood, the incision, the surgeons holding a man open while a crowd watches in silence. And at the center of it all, calm, composed, almost disturbingly unfazed, stands a man with blood on his bare hands, lecturing as if this is just another day at work. This is The Gross Clinic, painted in 1875 by Thomas Eakins. And when it was first shown to the public, people didn't just dislike it, they rejected it. Not because it lacked skill, not because it was unfinished, but because it showed something people weren't ready to see. This painting doesn't romanticize medicine. It doesn't soften the reality. It forces you to sit with it, to watch, to confront the moment where science and suffering collide. And the most unsettling part, everything you're looking at was real. To understand why this painting hit so hard, you have to understand when it was made. In 1875, surgery was nothing like what we imagine today. Anesthesia had only recently been introduced, so yes, the patient is unconscious. But antiseptic practices? Those weren't widely adopted yet. Which means that even if a patient survived the operation, there was still a very real chance they wouldn't survive the infection afterward. The man at the center of the painting, Dr. Samuel Gross, was one of the most respected surgeons in America. And what he's doing here is actually considered cutting edge for the time. He's removing infected bone in an effort to save the patient's limb instead of amputating it entirely. So this isn't reckless, this is progress. But progress, at this moment in history, was messy, dangerous, and deeply uncomfortable to witness. Let's really look at what Eakins is showing us, because every part of this painting is deliberate. Your eye is immediately drawn to the center, at Dr. Gross. He's elevated slightly above everyone else, both physically and symbolically. The light hits his face, his forehead, his hand, guiding your attention exactly where Eakins wants it. And that hand is impossible to ignore. It's covered in blood, not hidden, not minimized, just there. And what's unsettling isn't just the blood, it's how casually he holds it. He's mid-lecture, speaking, teaching, as if the human body opened in front of him is simply part of the lesson. Around him, the other doctors are deeply focused. One administers chloroform, another stabilizes the patient. Others assist directly in the operation. There's a rhythm to it, almost mechanical. Everyone knows their role, but then you look at the patient, and suddenly, everything shifts, because the patient is almost invisible. His face is obscured, his identity erased. He's reduced to a body, to a problem to be solved. And that tells you something important about this moment in medical history. The focus isn't on the individual, it's on the advancement of knowledge. Now shift your gaze to the left side of the painting. There's a woman sitting there, turned away, her face buried in her hands. She cannot watch. While everyone else leans in with curiosity, she recoils in horror. She's often interpreted as the patient's mother, and whether that's historically accurate or not, symbolically, it works. Because she represents something completely absent from the rest of the room: emotion, empathy, human reaction. She's the only one responding the way most of us would. Eakins is almost splitting the audience in two. On one side, the doctors, the students, the observers who are fascinated, engaged, detached. And on the other, this woman, overwhelmed, unable to process what she's seeing. And then there's the background. Rows of men sit in shadow, watching from above. Some are paying attention. Some seem distant, even bored. This isn't just a surgery, it's a performance. And hidden among them, Eakins includes himself, quietly observing, sketching, recording. He places himself not as the subject, but as a witness, which makes this painting feel even more unsettling. Even the lighting reinforces this tension. The scene is almost theatrical, bright light illuminating the surgeon, while everything else fades into darkness. It creates a kind of spotlight effect, like a stage, like you're watching something you shouldn't be seeing, but can't look away from. When the Gross Clinic was submitted for exhibition in 1876, it was rejected from the main art show, and that decision says everything about the expectations of the time. Art, especially in the 19th century, was supposed to elevate, to inspire, to beautify reality. Even historical and dramatic scenes were often idealized, clean, composed, and emotionally distant. This painting does the opposite. It confronts you with something raw, something physical, something undeniably real. The blood isn't symbolic, the suffering isn't implied, it's present. And for audiences at the time, that was too much. It blurred a line people weren't comfortable crossing, the line between art and reality, between observation and participation. Because this painting doesn't let you stay detached. It puts you in the room, and once you're there, you can't escape it. Today, the Gross Clinic is considered one of the greatest American paintings ever created, but its impact hasn't really softened. If anything, it's become more powerful, because now we understand what this moment represents. Not just a surgery, but a turning point. A time when medicine was evolving faster than people could emotionally process. And Eakins chose not to hide that. He didn't clean it up. He didn't make it easier to look at. He showed it exactly as it was. And in doing that, he created something that still challenges us. Because even now, almost 150 years later, you still have to make a choice when you look at this painting. Do you lean in, like the doctors? Or do you turn away, like the woman?